Hi, my name's Harpreet, and this is a Foley catheter insertion video. So I want to begin by making sure there's an order for the patient for insertion of the Foley catheter. So I want to also look over the patient's chart to make sure that there's no contraindications for administering the Foley catheter. So this would include, for a male, enlarged prostate, urethral stricture. So then I would perform hand hygiene, go to the patient's bedside, identify them by two identifiers, the first and last name, and their date of birth. I would then raise the height of the bed to a good working height. I would then apply clean gloves. I will examine the patient by palpating his bladder for distension. I'll then help him into a supine position with his legs extended and his thighs slightly abducted. I will cover his upper body with a bath blanket, and I would drape his lower body with a separate sheet or bath blanket. I will ensure that there is a waterproof pad under the patient. And then I would then wash the perineum with soap and water and then rinse and dry. While wearing gloves, I will identify the patient's urinary meatus. I will then remove and discard my gloves, perform hand hygiene. I will then remove the outer wrapping of the catheterization kit. In doing so, I will maintain the sterility of the inner wrapper by making sure my hands are always above my waist and making sure that I don't touch anything unsterile. I will then place the tray of the inner wrapped catheterization kit on a clean surface, or if possible between the patient's open legs. I will then apply sterile gloves. I will then prepare to drape the patient's perineum while making sure my gloves are sterile, so I don't touch any unsterile surfaces while wearing the sterile gloves. I'll continue by picking up the square drape, allowing it to unfold without touching any unsterile surfaces. And then I would place the drape shiny side up, down, just below the patient's penis, over the patient's thighs. I would then pick up the fenestrated drape, and I would lie it on the patient's perineum so that only the penis is exposed. I will then place a sterile tray on the sterile drape. The sterile tray contains cleansing medium, forceps, lubricant, and a pre-filled syringe to inflate the balloon. It also contains cleansing medium. I will then open up the sterile antiseptic solution and pour it over the cotton balls. I will then open the pocket of lubricant and squeeze it onto the sterile field. I would then apply lubricant to the catheter, 5 to 7 inches from the tip of the catheter, so that 5 to 7 inches are lubricated from the tip. With my non-dominant hand, I will retract the foreskin of the patient if they're not circumcised. I will then gently grasp the shaft of the penis just below the glans. Again, this is with my non-dominant hand. I will maintain the non-dominant hand in this position for the remainder of the procedure, as it is now contaminated. With my uncontaminated dominant hand, I will use forceps to pick up the cotton balls. And I will move in a circular strokes, beginning at the urinary meatus, moving out in a spiral fashion. I will repeat this process 3 times using a clean cotton ball or swab stick each time. I will dispose of the cotton balls so that they do not contaminate the sterile field. I will pick up the catheter 3 to 4 inches from the tip. I will then gently apply upward traction to the penis to straighten it, straighten the urethra with my non-dominant hand. I will then slowly insert the catheter through the urinary meatus. If the catheter is connected to a collection device, I will make sure that it will drain. If it's not connected into a collection device, I'll make sure that it'll drain into a sterile container. I'll advance the catheter 7 to 9 inches until urine flows out of the catheter. I will then I will not force the catheter if I feel resistance or if the patient feels any discomfort or pain. I will ask the patient to take slow, deep breaths to promote relaxation. If I have difficulty advancing the catheter, I'll hold it in place to allow the sphincter to relax. After the urine appears, I'll advance the catheter to the bifurcation of the drainage and balloon inflation port. I will then lower the penis but continue to hold the catheter with the non-dominant hand. Then use my free dominant hand to connect the pre-filled syringe. At the end of the catheter, I will slowly inject the recommended amount of solution to inflate the balloon. I will then release the catheter from my non-dominant hand, and I will gently pour the catheter and pull the catheter until I feel resistance. That's again with my dominant hand. I will secure the catheter with a strap. I will attach the securement device just at the catheter bifurcation, securing the tubing to the patient's inner thigh. I will attach the drainage bag to the patient's bedside bed frame from below his, making sure it's below his bladder. I'll make sure the urine flow is unobstructed. If the patient is uncircumcised, I will return his foreskin to its natural position, but not before cleansing the area to remove any remaining iodine-based solution. I'll provide the patient with hygiene care, and I'll help them to a comfortable position. I'll dispose of any supplies, my gloves, and perform hand hygiene. As part of follow-up care, I'll measure and record urine output and characteristics of urine, such as color, clarity, odor, and amount. Thank you.